Here are 12 terms you need to know about your health insurance. Because when you understand your health plan, you can get the most from your benefits. Let's start with the term you see every month. Your premium, simply put, is the monthly bill you pay, or your employer pays on your behalf, for insurance coverage. Payments for your premium do not count toward your deductible. The next few terms are about cost sharing, which are amounts that you have to pay for covered services. You pay your deductible for certain services before your plan begins to pay for eligible charges from providers and facilities. While a deductible is more often paid over a longer period of time, a copay is an upfront fee you pay to a provider or facility for medical services. Depending on your plan, this may count toward your out-of-pocket maximum. If your doctor prescribes medications, you may also need to pay a pharmacy or RX copay, which is an upfront fee for certain types of drugs. Coinsurance is a percentage of charges that you pay a provider or facility. Coinsurance usually applies after the deductible has been met, commonly 80-20 coverage. This means your health plan will cover 80% of charges after your deductible, and you would be responsible for 20% of the provider and facility charges. After your insurance provider has paid their portion of the bill, if applicable, you are left with a specific amount. This is called the total member responsibility and includes copays, coinsurance, and the deductible. The maximum amount you will pay toward your deductible, copays, and coinsurance is called an out-of-pocket maximum. If you meet the out-of-pocket maximum, eligible charges for most services are covered 100% for the rest of the year. Your health plan has negotiated with participating providers to get a discounted amount for healthcare services, also called the allowed amount. Any dollar amounts that exceed the allowed amount for a covered service are referred to as excess charges. If you are using a participating provider or facility, they will not ask you to pay this amount. Each time a claim is processed, there is an associated explanation of benefits, or EOB, that explains how much was paid, how much you are responsible to pay, and more. Some exceptions apply. High deductible health plans, or HDHP, are becoming more popular. These plans generally have higher deductibles and lower premiums and are typically paired with a health savings account. They are a great option if you don't have to use your benefits regularly. Speaking of health savings accounts, this brings us to our last term that you need to know. Think of a health savings account, or HSA, as an account that you can use for qualified medical expenses. Some examples include doctor's visits, co-pays, dental care, and prescriptions. The tax-free funds in an HSA can be saved from year to year. That sums up the 12 health insurance terms you need to know. Visit us at selecthealth.org for additional useful information about your health plan.